This video is for women only, and I mean it, because we're going to talk about back pain in menstrual cycles, back pain in PMS, and increased back pain during your period. So I'm pretty sure most of the guys would like to just skip through this video now that I said all that. But for you ladies, for us women who may have already noticed that you tend to injure your back during your period or right before it, or have more back pain during PMS or during your period. So this is a reality. This is a story for so many of us, and there are reasons, there's science behind this. So the first thing is you should know about hormones, estrogen and relaxin, which relaxin is a hormone that changes during our cycle, and particularly right before and into our cycle, we have higher levels of relaxin, and relaxin is a hormone that sounds like its name. It actually creates ligament laxity. It creates decreased strength and support in our pelvic lumbar region. So is it no wonder if our ligaments are kind of on vacation that we may have more back pain, particularly if we have pre-existing conditions like arthritis or disc bulges or spondylolisthesis. Any weakness in the spine that's already there is exacerbated before and during our period, hormonally caused. Not to mention that if you have dysmenorrhea, really heavy periods, or even for some people who have normal blood flow, the contractions of the uterus will also refer pain to the back. Heavy blood flow, dysmenorrhea, we have inflammation that might be increased during our period, and that too creates pressure on the nerves of the lumbar pelvic region, also supporting our back pain. So we have multiple causes for increased back pain and increased injury right before and during our period. And I'm sharing this with you because that means there is something we can do to prevent injuries before and during our period, just by having that wisdom, that knowledge that our tissue, our structural integrity is more vulnerable at this time, means you may choose to be more careful with your activities before and during your period. Not a great time to do a deep house clean. Not a great time to increase your mileage on a run, or to begin a new weight training or sport athletic event even. You may just postpone it for a few days. You want to be aware. I ask my patients who have chronic back pain to always mark their calendars so that they're aware a few days before their period, up to a week, and aware, well, certainly it's easy to be aware when we have it, but you want to know when it's coming, because that is not a time to sit in poor posture for 8 hours at the desk. This is a time that you'll be more vigilant on how you're sitting, how you're standing than ever before. Use props, don't sit too long, get up more often than you may otherwise would have, and choose your activities and athletics more wisely to prevent injury during vulnerable times. So that's all I want to say. One, it's not in your head. Two, there's a science and a tissue, soft tissue, musculoskeletal vulnerability that is there. And so address it wisely with how you choose to sit, stand, walk, and act during those times. And then good luck, ladies, in managing your back pain and being smarter about it.